Mr. President, I believe in markets and I believe in transparency, and that's what I want to talk about today. I think that markets generally are the best allocators of goods and services. But in order for markets to work, people who purchase, consumers, need information. And I want to address one small piece of a very important market today. I serve on the Budget Committee of this body, and as such, I've had an opportunity to look at not only the current budget, but projections of future budgets. And I think it's important to emphasize that virtually all the growth in future federal budgets is attributable to health care. All the growth. It's not Pell Grants, it's not national parks, it's not national defense, it's not the National Security Administration, it is all in health care. And there are several ways that we can control those costs. One way, which has been suggested, is to simply shift those costs off to other people, to the states, to elderly, to other citizens, and say it's not the federal government's problem, it's someone else's problem. I would suggest, Mr. President, that that's not the answer. We need to be focused on the issue of health care costs generally, for everyone, for the federal government as a consumer, as it is in Medicare and Medicaid, but also for all of us as health care consumers across the country. So the standard response around here to growing health care costs is to cut programs, cut recipients, reduce payments to states, or reduce payments to providers. That does nothing about the fundamental issue. I can tell you that none of these steps has anything to do with reducing the demand for services or the costs of those services. We have to spend the money that we have more responsibly. Now, there have been discussions recently about repealing the medical device tax, which was passed as part of the Affordable Care Act. And the theory, by the way, was that the Affordable Care Act would produce, as it has, millions of new customers, both for the private insurance industry, but also for all of those who participate in the healthcare system, including those who manufacture medical devices. The Affordable Care Act has produced new customers. And the theory, as I understand it, I wasn't here when the bill was originally passed, but the theory was the industry, the businesses that will profit by the production of new customers through new people gaining insurance who'd never had it before, was that part of that would be paid back to support the overall system. That was the idea of the tax on medical devices. Now, I realize that it's a controversial tax and that strong arguments can be made that it should be modified or reduced. But the repeal of the medical device tax would cost the government $29 billion over the next 10 years. That's money, as we all know, that has to be replaced somewhere else. So I think that's a consideration that has to be taken into account as we discuss this matter, which is under consideration as part of the tax extenders package. But as I looked into this issue and thought about the medical device industry, I was surprised to find that it's very difficult to find out the price of an implantable medical device. Because one of the reasons is that the hospitals, who are the purchasers of these devices, are often prevented by agreements from the medical device company from revealing the price that they pay. In other words, there's no transparency about the prices of these devices, which find their way into the cost of everybody's health care. Now imagine for a moment that you were going in to buy a new car. There were no advertising about the prices of the cars. You couldn't go on the internet and determine the prices of the cars. You couldn't compare the prices of the cars from one dealer to the other. But you go in and somebody behind a closed door says, okay, the price is $20,200, but you're not allowed to tell anybody the price you paid for this car. And you have to sign an agreement that you will keep that price secret. Imagine that system. And imagine for a moment what would happen to the price of cars. I don't think it's gross speculation to assume that the prices would go up because there's no transparency. And so I've submitted an amendment to the tax extenders package, it's Amendment 3802 to H.R. 3 474, which is the tax extender's bill that's pending, that simply says when a medical device is being sold, the manufacturer cannot impose a secrecy provision on the hospitals that purchase these devices, and also have to report median prices to the Secretary of Health and Human Services on a regular basis. In 2012, the GAO did a report on Medicare, and one of the pieces of the report was titled, "Lack of Price Transparency May Hamper Hospitals' Ability to Be Prudent Purchasers of Implantable Medical Devices." A long title, but the conclusion is contained in the title, "May Hamper Hospitals' Ability to Be Prudent Purchasers." Well, if hospitals can't be prudent purchasers, we who are paying the bills quite often through Medicare and Medicaid are not able to get the best prices. Who pays? All of us pay. This amendment would prohibit medical device manufacturers from requiring hospitals and buyers to sign purchasing agreements that contain confidentiality clauses that would restrict them from revealing the prices paid for medical devices to third parties. In addition, as I mentioned, the amendment would require these manufacturers to submit the average and median sales prices of covered devices to the Secretary of Health and Human Services on a quarterly basis. In 2007, my good friend Senator Grassley from Iowa sponsored a bipartisan bill to create a process of reporting this kind of price data to HHS, and I believe it's time to do just that. To the extent that the prices of implantable medical devices, which are very expensive generally, are not disclosed, the ability of hospitals to bring price information to bear in negotiations and decisions is clearly limited. So I believe that if we're going to talk about repealing the medical device tax, we should also talk about calling upon the industry to provide to consumers and policymakers greater transparency in order to better control costs. In a world of limited resources, we have to spend the money we have most wisely. It's very difficult to spend money wisely if prices and comparative prices and prices to your various components of the healthcare system are essentially kept secret. This is a simple amendment. It is simply based upon the fundamental idea that markets work, but they only work when consumers, in this case hospitals, have the information necessary to make good purchasing decisions. I think markets, as I said at the beginning, are the best way to allocate goods and services, but that information is necessary for markets to work, and that's the purpose of this amendment.